Epiphrenic diverticulum. Epiphrenic diverticula typical areas proximal to the lower esophageal sphincter. They are due to the development of the esophageal mucosa and mucosa tissue within the area in the muscular layer as a result of syncrease intraluminal pressure. They are commonly associated with underlying motility disorders such as achilles. Diverticulum might be through a layer consists of the cavity two from which they are formed. A fall or pseudodiverticula must form via the layer of the wall of the cavity or two from which they are formed.
Zenker's diverticulum usually presents in an older person with difficulties to swallow. Generally, its solids give the patient the majority of the difficulties, and liquids are not so hard. They often pass without a problem. One of the things that happens is that the food will get stuck in the diverticulum, which is actually a sac. And because of that, the patients will often complain not just the food sticking, but the fullness of the neck. And then they'll actually cough out the food 20 or 30 minutes later after eating, and the food will be completely undigested because it's been sitting in your throat. It hasn't gone down to the stomach where it would have been digested. So that is something that's very typical of Zenker's diverticulum.
Clinical manifestation: dysphagia, deficiencia, aspiration. The epiphrenic diverticula usually present another neck size, although layer proportion can be achieved even a reduction of producing the esophageal lumen. Area of diverticula epiphrenic with diverticula. Diverticula wall is formed via mucosa which increases the risk of swelling by the endoscopy.
Zenker's diverticulum surgery by Dr. Christopher Chang of Fokker ENT Consultants. In patients suffering from Zenker's diverticulum, there is the abnormal presence of a pouch in the throat which causes food and liquids to get caught during swallow. In a normal swallow study, everything clears easily down the throat, but in a patient with a Zenker's pouch, things get caught causing symptoms of phlegmy throat, food regurgitation, aspiration, and trouble swallowing. Traditionally, surgical correction required an incision on the neck and pouch excised, which resulted in a long recovery. However, recent surgical advancements in the late 1990s resulted in a new endoscopic technique to correct this problem without any incision in the neck. Rather, the entire surgery is performed endoscopically. After intubation, a laryngoscope device is placed into the mouth and pushed down into the throat where the pouch is located. Once the pouch is visualized along with a common wall dividing it from the normal swallowing tube, the laryngoscope is placed in rigid suspension. Here you can see how the laryngoscope is placed relative to the pouch. Once the laryngoscope is optimally adjusted, a rigid endoscope is then inserted in order to obtain a magnified view of the pouch. Here, a metal rod is in the normal swallowing tube, clearly illustrating the common wall separating it from the pouch. Sutures are placed to help stabilize the common wall in preparation for the stapling procedure. A total of 2 sutures are placed. Between the 2 sutures which are placed in tension, the stapling device is then inserted such that the common wall is placed between the stapler blades. With activation of the stapler device, it simultaneously cuts and staples the cut edges together, resulting in a V-shaped division down the common wall. The sutures and any free staples are then removed. With this common wall division, any food or liquids that
Conclusión. The epiphrenic diverticular occurs. The cause many symptomatologies may go unnoticed. Usually, the diverticular occurs in the eye and the elderly, with more discreet in males. Every year, a less than symptomatology show little surface. The main diagnostic method is esophagogram.